Thanks for coming and chatting with me today, Sarah.
Thank you for having me.
So I want to know more about what you do here at the Princess Margaret with patients who are going through prostate cancer treatment.
Okay.
So maybe you can tell us a little bit about why nutrition is so important for patients on treatment.
Okay. So nutrition is a very important component for anyone going through treatment for prostate cancer, whether it's before treatment, during treatment, or after their treatment. Nutrition is so important because we want people to be able to maintain their weight and maintain their nutritional status while they're going through treatment. That's going to help them keep their body weight up, keep their body strong, as well as help with tissue repair, tissue rebuilding, and help their immune system and fight infections.
So what are some of the most common nutrition-related side effects or problems that patients come to you with during their treatment?
So some of the side effects could include things like diarrhea, gas and bloating, as well as loss of appetite. And this can be because of radiation people are having, chemotherapy, or maybe even a combination of both. So my role would be to help address those side effects while they're going through treatment to help them maintain their weight, maintain their strength, and keep their nutrition as good as possible. It depends. A lot of times people come into their treatment thinking, I need to be having a healthy, well-balanced diet, and to them that always means high fiber, lots of fruits and vegetables, grain products, legumes, things like that. But it's important to realize that if someone's going through treatment and they're having a side effect that affects the way they're eating and affects what they can eat, it's okay in that time period to make changes to the diet. So even though we would normally recommend eating well with Canada's Food Guide, if someone's having the side effect of diarrhea, we want to suggest, say, lower fiber or lower fat or maybe less lactose so that they can manage that side effect and get through their treatment.
So with the gas and bloating and some of those side effects that you were talking about, would it just be avoiding the fiber, or are there any other things that people can do?
Yep, so there are some food things that they could avoid. So there's certain vegetables, for example, broccoli, cauliflower, Brussels sprouts, cabbage, the ones that can cause gas. Also avoiding higher fat foods, maybe avoiding beverages that are carbonated, so certain things like pop, like ginger ale, Sprite, and those types of things, as well as certain other behaviors. So simple things like taking your time to eat, chewing your foods very well and keeping your mouth closed so you're less likely to swallow extra air. Avoid sucking on candies or chewing gum, again, to avoid swallowing excess air. And another one is even just trying to avoid an empty stomach, because sometimes when our stomach is empty, we can produce a little bit more gas, and then that can contribute to more gas and bloating.
So don't go hungry. Try to eat some smaller meals during the day.
Yes, snacking is good.